Hey guys, it's Dr. George here, and I wanted to have a brief chat about gonorrhea. Recently, there has been an increase of gonorrhea noted within certainly my own clinical practice, so I thought it was important that I had a brief chat about some of the facts around gonorrhea. Gonorrhea is a sexually transmitted infection that is caused by bacteria. It's really common and it's easily transmitted through all forms of sexual intercourse. That includes oral sex, anal sex, even things like using spit for lube can sometimes transmit gonorrhea from places like the throat into the bum. So gonorrhea usually has symptoms that show up 1 to 3 days after you've been exposed. And this can be in the throat, in the bum, in the testicles, and when it's in the penis, the symptoms are usually fairly obvious. The most common symptoms are a discharge, and when it's in the penis, it's usually a creamy, grey, yellow, and sometimes green pussy discharge from the eye of the penis. It's a very obvious sign. However, people can have gonorrhea in the throat and in the bum with no symptoms at all. So the way that we find out if a person has gonorrhea is firstly the obvious symptoms. If you've got testicular pain, if you've got pus coming through the eye of your penis, then it's really important that you go and see a doctor and go and get checked out. If you get a message from somebody or somebody phones you up and says, hey, look, I've just been exposed to gonorrhea, you may have been as well, then it's really important. Go and see your doctor and you can get screening done. The other thing is that it's really important that all gay men get regular screening, and not just for gonorrhea, but for all sexually transmitted infections. In particular, the way that we screen for gonorrhea is through swabs, and that is a throat swab, a bum swab, and also a swab of either down the eye of the penis. It's a little bit uncomfortable, but it's important that it's done. Also, there are tests that can be done with urine. However, if you have symptoms of gonorrhea, it's really important that we get a good swab of it, because we want to make sure that the antibiotics that we're going to be using are the best antibiotics to kill that particular version of gonorrhea. The treatment is fairly straightforward. The standard treatment is an injection of an antibiotic as well as a dose of 2 single tablets that are taken at the same time. After treatment, it's really important that you have no sexual activity for at least a week, and that includes sex with condoms, because it can be so easily transmitted to your partners. If the symptoms aren't going away, it's really important you go back and see your doctor, because you may have one of the rare cases of resistant gonorrhea. So it's important that you get that checked out. Normally, if the gonorrhea is just in the penis, we don't need to do a test for cure, but occasionally, particularly gonorrhea in the throat or gonorrhea in the bum, because it doesn't have much in the way of symptoms, it's probably worth going back, seeing your doctor, and just getting a second swab done to make sure that all of the bugs are gone. For this reason, it's really important everybody get a regular sexual health screening. I recommend that everybody get a full sexual health screening every year, and that includes a blood test, and that's to check for HIV, syphilis, and also make sure that you're up to date with hepatitis A, B, and whether or not you've been exposed to hepatitis C. We're going to do swabs, and that's for chlamydia and gonorrhea as well. If you've had more than 10 sexual partners in less than 6 months, you should get a sexual health screening every 6 months, or every quarter if you're doing particularly well. The other reasons to go and see your doctor is if you have symptoms, and that includes burning or stinging when you pee, discharge coming out of the eye of the penis, or anal pain, and even a sore throat that doesn't seem to be budging. It's worthwhile going to see a doctor. If you get notification from somebody saying that they've just been treated for gonorrhea, it's really important you go and see your doctor to get screened, but also to be treated. If you're not sure, be sure to talk with a doctor who has an interest in gay men's health. I emphasize this because whilst all doctors are trained to look after sexual health infections, it's doctors with an interest in gay men's health that can make sure that you get all of your bases covered. Anyway, I hope that this message arrives to you happy and healthy, and if you have any questions, please feel free to contact me via the website below, gaymenshealth.com.au.